Hey guys, it's Sam and Megan again. So today we're going to talk about donning and doffing your PPE for our COVID patients. So just going to talk about everything on this table here. So you got your gown, you got your Purell, your face shield, your cap, your eyewear, gloves, and then our N95s in here. We're going to act like it's used with a bag that's labeled appropriately. So Megan's going to be our person that tries this on here. So one thing I do want to say, before you go into a room, you want to make sure you take all of your jewelry off that you can, and then also taking your phone out of your pocket so that you're not, reaching into your scrubs with dirty hands. So we're going to start with donning our PPE. So we start with hand hygiene here. And then we're going to put our gown on. For this demonstration, we're using a yellow gown, but if you do have someone that's having an aerosolizing procedure, say like a nebulizer, or you're intubating, you want to use the blue non-permeable gowns. So after we have our gown on, then we're going to get our N95 out. We're going to get clean gloves, and we're going to pull our N95 out of the bag by the straps or the outermost part. Perfect. And we are using a surgical mask because we don't have, we're conserving N95, so bear with us as we kind of demonstrate this. So you want to have one strap above your ear and one strap beneath, and make sure that it has a good fit around your nose and mouth. So then we're going to take our gloves off, do hand hygiene. And then we're going to start by putting our, let's say we'll put the cap on and then the eyewear. It doesn't really matter what you do first, but. Followed by our face shield. Perfect. Then our gloves are the last thing. And just to note, this should be done in the ante room, not in the patient's room or outside of the ante room. So now we're ready to go in the room. So now you're done taking care of your patient, you're going to take your PPE off. So the first thing we're going to start with is the gown and gloves. So you're going to pull at the top and then at the waist. And you're going to remove the gown with the gloves, being sure that you're touching dirty to dirty and clean to clean. So I would just roll that downward. Yep, being sure to not touch yourself and throw it straight in the trash. Perfect. All right, so after that, hand hygiene. Then we're going to take all of our eye protection off after we put clean gloves on. And this is going to act as like our dirty area. In every ante room, it's probably good to have a dirty area. So when you take your face shield and your goggles off, you have a place that you can clean with bleach and Oxivir. So we'll take the face shield off first here. Set that there. The cap and the goggles go on here. Yep, perfect. And then the cap just goes in the trash. Then you're going to take those gloves off. Hand hygiene and get new clean gloves. Then you'd want to have a clean bag set up already with your name on it in the ante room, hanging up for your N95 so that you can reuse it. Now when taking the N95 off, you want to do it by the straps or the front part of the mask. Now this is a little harder because it's a surgical mask, and then you're going to place it right down in the bag. Perfect. Then we're going to take our gloves off, do our hand hygiene, and then you would clean your face shield and your goggles with bleach or Oxivir and let them dry.